Welcome back. Brian Andrews is one of the two National Guard representatives that sits on the HIDTA Prevention Committee and the ADAPT Advisory Council. Here he is to introduce.
Welcome back to the final session of the 4th Annual HIDTA Prevention Summit. I'm Captain Brian Andrews from the National Guard Bureau, and I also sit on the ADAPT Advisory Council. Throughout the day, we've been given an array of substance use prevention grounding principles, education, and skill building. I myself have already identified several ways I can further assist the National Guard counter-drug program in moving further towards extraordinary. The field of substance use prevention is large, and its reservoir of resources impressive. I now have the honor of introducing speakers from several agencies to speak on this reservoir of resources they've developed and made available to support each of us in our work. Jessica Wolff is a lead health scientist within the Centers for Disease Control and Prevention, National Center for Injury Prevention and Control, Division of Overdose Prevention, and is a team lead for the Public Health and Public Safety team. Ms. Wolff oversees the public health arm of the Overdose Response Strategy, a collaboration between CDC, ONDCP, and the HIDTA program to implement public health, public safety strategies at all levels. Ms. Wolff oversees a team providing training and technical assistance to public health analysts in each ORS state and serves as a primary liaison between CDC and the ORS public safety partners. Ms. Wolff also oversees the implementation of many public health, public safety initiatives with additional partners including the Bureau of Justice Assistance, the National Governors Association, and the National Council for Behavioral Health. Ms. Wolff has 9 years of program experience in evaluation and project management experience in a variety of public health fields, including global HIV/AIDS prevention, youth suicide prevention, and children's mental health services. Holly Hagle is an assistant research professor at the Collaborative to Advance Health Services, University of Missouri, Kansas City's School of Nursing and Health Studies. Dr. Hagle is a co-director of the National Addiction Technology Transfer Center, Network Coordinating Office, and Principal Investigator for the Prevention Technology Transfer Center Networking Coordinating Office. In addition, she is the UMKC Principal Investigator and Co-Director on behalf of the ATTC Network for the Opioid State Targeted Response Technical Assistance Grant. Dr. Hagle has been actively working with medical and behavioral health providers for over 20 years on the integration of behavioral health interventions, including educational program on intercultural sensitivity. Her area of expertise is in adolescent co-occurring disorders, screening, brief intervention, and referral to treatment, and the application of evidence-based practices in community settings with a special focus on qualitative research methods. Major General retired Barrye L. Price is a 1985 Distinguished Military Graduate of the University of Houston's College of Business Administration. He earned a Master's of Arts in History from Texas A&M University, and in 1997 obtained a doctorate from the Department of History, becoming the first African American to do so in Texas A&M's 136-year history. He also earned a Master's in Science and National Security Strategy from the National Defense University in 2004. General Price has a long list of prestigious assignments that can be viewed and has provided detailed biography. He has received many personal honors during his Army career, including the Army Distinguished Service Medal, the Defense Superior Service Medal, 2 Legions of Merit, and the Bronze Star Medal. He is also entitled to wear the Army Staff Badge and badges for airborne and air assault. Major General Price assumed his duties at CADCA, the Community Anti-Drug Coalitions of America, as the Executive Vice President and Chief Operating Officer in October of 2016. As of September 1st of this year, he became the President and CEO of CADCA. Helen Hernandez currently serves as the Assistant Director of the Drug-Free Communities DFC Support Program in the Executive Office of the President at the Office of National Drug Control Policy. In this role, Ms. Hernandez oversees the nation's leading effort to mobilize communities to prevent youth substance use. She manages the grant-making process, oversees the national cross-site evaluation of the program, and is responsible for key trainings and events for the DFC program. In 2010, Ms. Hernandez enlisted into the U.S. Public Health Service and was stationed at the Substance Abuse and Mental Health Services Administration Center for Substance Abuse Prevention as a public health advisor for the DFC program until 2013. Prior to joining the federal government, Ms. Hernandez served as a health educator with the Miami-Dade Area Health Education Center as a breast cancer awareness and prevention advocate, where she delivered over 300 bilingual trainings to a primarily youth-based audience. Ms. Hernandez earned her Bachelor of Science degree with health education from the University of Florida and received her Master's in Public Health with a concentration in Community Health from Florida International University. Sean Fearns serves as the Chief of Community Outreach and Prevention Support for DEA since 2015, a position that includes management of the DEA Museum as well as the DEA Community Outreach and Prevention Support section. In this capacity, Sean is responsible for guiding a diverse and creative staff in the development and implementation of strategic national partnerships with other organizations who help educate the public on the current drug threats facing the country. This position also supports DEA field office divisions and communicates key administration drug prevention messages to include the implementation of DEA 360 strategy. Please join me in welcoming this distinguished panel to learn about the valuable resources that are available surrounding substance use.
Great. Good afternoon, everyone. Thank you so much to ONDCP and HIDTA for this opportunity to share a little bit about CDC's prevention resources on this panel. As was mentioned in the introduction, my name is Jessica Wolff, and I'm a lead health scientist at CDC, and I oversee the public health and public safety team in CDC's Division of Overdose Prevention. So today I'll share some resources that my team has developed in collaboration with HIDTA and with other partners that are specifically focused on public health and public safety partnerships and on supporting individuals involved in the criminal justice system who also have substance use or opioid use disorder. And then I'll also touch on some of CDC's other prevention resources that are a little bit broader than those public health and public safety partnerships. So for those of you who listened in on the CDC panel this morning, some of this information may be a little bit of a repeat, but it probably doesn't hurt to hear it twice. So next slide, please. Great. So many of you are probably familiar with our Overdose Data to Action, or OD2A, funding, and you may have heard, as I mentioned, some of our earlier CDC panelists speak about this program as well. So this is CDC's largest funding effort to address the opioid epidemic. It was launched in September 2019, and over the next 3 years, we will provide nearly $1 billion in funding to 66 jurisdictions. So through OD2A, jurisdictions will continue work that was started and supported by some of CDC's previous funding opportunities. So some of the things that you see listed on the bottom of the slide here, things like increasing the comprehensiveness and timeliness of drug overdose surveillance data, making prescription drug monitoring programs, or PDMPs, easier to use and easier to access, and working with health systems, insurers, and communities to improve opioid prescribing. OD2A also adds some new opportunities for jurisdictions that are focused on, for example, linkages to care from emergency departments and criminal justice settings and community settings as well. And it also provides opportunities for funded recipients to focus on some innovation supported by evidence-based practice. So the funded recipients can select the activities within different surveillance and prevention components, and also have the ability to kind of tailor their OD2A program to the needs in that particular state. So if you would like to make connections to the OD2A work happening in your state, please reach out, and we're happy to try to facilitate that and help make those connections. Next slide, please. So many of you have also heard earlier this morning, or maybe in some other settings, about the overdose response strategy, which is a public health and public safety partnership between HIDTA and CDC. So in 34 states, which you see in light blue on the map, we will soon have a public health analyst funded by CDC through the CDC Foundation. And that PHA will work closely with a drug intelligence officer, or DIO, in their state. And that position is funded by ONDCP through the HIDTA program. So in the states that are in dark blue on this map, at this point, we just have a drug intelligence officer, but the hope and the goal is to expand and to add a public health analyst to those states to make this a truly national public health and public safety program. So our public health analysts and our drug intelligence officers work together on drug overdose issues within and across sectors and states, and they share information about public health and public safety data related to overdose. And the ORS is really growing the body of evidence related to early warning signs and prevention strategies. PHAs and DIOs are sharing data and trends related to drug overdose, but I think more importantly, they're also helping their communities develop really local solutions to reduce overdose and save lives. So we would absolutely encourage you to consider the public health analyst and the drug intelligence officer to be a resource in your state that you can tap into. On this slide, I've provided the overdose response strategy website that will, if you go to that link, you'll get the contact information for the public health analyst and the drug intelligence officer in each of our ORS states. So you should absolutely feel free to reach out to them and they can connect you to the information that you need. Next slide. So in our public safety work and our work within local communities, we kind of kept getting asked, what should we be doing more of? How do we know what works when it comes to preventing overdose? So to answer those questions, we pulled this guide together that showcases 10 best practices to prevent opioid overdose. So in the document, there are a number of harm reduction strategies, like targeted naloxone distribution and syringe service programs. There are several treatment-related strategies, like medications for opioid use disorder in criminal justice settings and initiating medications for opioid use disorder in the emergency department. We also have a strategy focused on academic detailing and another one on fentanyl toxicology screening. So for each of these strategies, we gathered the evidence from the literature, condensed it all down into a really user-friendly guide. And for each strategy, we also highlighted examples or case studies from programs on the ground that have successfully implemented these strategies. So I've provided the link here to the guide, and I encourage you to share it widely, or even some folks who print off hard copies and have handed those out at task force or coalition meetings. And, just a note to acknowledge that this was written in 2018, but the strategies are still absolutely applicable and relevant. And we do hope to be able to make an update to the document soon. Next slide. So next, I just wanted to highlight some tools and resources that are specific to work in criminal justice settings or with individuals who are involved in the criminal justice system or between public health and public safety partners in general. So the document that you see on the far left and then the document that you see on the far right are cornerstone reports that we developed through the overdose response strategy. Each year, the overdose response strategy focuses on a topic that is highly relevant to both CDC and HIDTA. And then through our public health analyst and drug intelligence officer network, we do kind of a deep dive to learn more about how those topics or those strategies are kind of playing out in the real world. We then pull together a final report that provides aggregate findings and some recommendations for how to implement and how to evaluate those strategies. So in 2018, we focused on 5 different types of linkage to care programs at the intersection of public health and public safety. So specifically, we looked at drug courts, pre-arrest diversion programs, linkage to care post-release, police-led post-overdose outreach, and safe stations. And then in 2019, our most recent report, we focused on overdose prevention in jails. So those types of strategies include medications for opioid use disorder, implementation in the jail setting, naloxone distribution and overdose education, and then linkage to care post-release. So for each of those strategies, we provide recommendations for how to implement and evaluate those kinds of services. You can download the reports and guidance documents at the link that you see on this slide. And then I also included them in the resource booklet that you'll have for today. So if you're interested in learning more about how to implement or evaluate these types of programs that involve public safety or the criminal justice system, I would highly encourage you to check that out. Likewise, we worked with the National Council for Behavioral Health to develop a toolkit for implementing medications for opioid use disorder in jails and prisons. And this toolkit takes a little bit of a deeper dive than the report that I was just mentioning and goes into some kind of nuts and bolts about how to implement these programs. And again, you can find the PDF of that toolkit in your resource booklet. And then lastly, at CDC, we obviously recognize the importance of public health and public safety collaborations in this space. We put a lot of effort and investment into building these partnerships at the federal level. But we also acknowledge that there can be some challenges or hurdles to overcome in getting these kinds of partnerships off the ground. So we worked with Bloomberg Philanthropies and the CDC Foundation to develop the Public Health and Safety Teams, or FAST toolkit, which you see here on the slide. And the toolkit walks partners through kind of step-by-step how to actually engage in and execute these public health and public safety partnerships. So from how to bring people to the table to begin with, how to agree on a shared mission and vision, and then how to start data sharing. And then after that, how to jointly move forward on implementing strategies that address what is being seen in the data. So in this toolkit, we even have some model data sharing agreements and MOUs. We got input from public safety partners as this was being developed. And right now it's being piloted in nearly a dozen localities. And of course, we'll make modifications as needed based on the findings from those pilot projects. So it's really, I think, an incredible resource. And in the resource booklet for today, there should be a link to the PDF of this toolkit. Next slide. Great. So I think you heard a little bit, if you were at the earlier CDC session this morning, about our prescribing guidelines. But in response to this critical need for consistent and current opioid prescribing guidelines, the CDC released the guideline for prescribing opioids for chronic pain in 2016. And these recommendations focus specifically on clinical practice and provide evidence and guidance for how to improve the way that opioids are prescribed and ultimately to improve patient care. So CDC has also developed a number of additional resources specifically for providers around the guidelines, which you can see on the slide here. So everything from interactive trainings, there's a mobile app, there's a pocket guide, fact sheets, and many other tools. So if you'd like to learn more about the guideline, you can do so at the link that's here on the slide. Next slide. So in 2017, we released the RX Awareness Campaign, and this campaign tells real stories of people whose lives have been affected by prescription opioids, with the goal to increase the awareness of how prescription opioids can be addictive. We released videos of individuals telling their stories, along with radio files, billboard signs, and a few other products as well. So the campaign really conveys that, although everyone has a different story, whether it's of personal addiction or a loved one's addiction, we can all play a role in preventing further addiction through education and awareness. So phase 2 of the campaign was launched in July of this year. And during this phase, CDC filmed and captured more real-time stories to add to the suite of campaign materials. So the new ad focuses on audiences that are heavily impacted by the opioid overdose epidemic, including pregnant women, veterans, younger adults, and American Indian and Alaskan Natives. And public health partners and community organizations can use the tested RX Awareness Campaign materials and resources to launch their own campaigns or to support local prevention activities and just in general to raise awareness about the risks of prescription opioids. So if you would like more information about the RX Awareness Campaign, you can go to cdc.gov/RX Awareness. Next slide. So thank you so much for your time today. That's it for me, and I look forward to hearing from our other presenters. Thank you.
Thank you, Jessica. And thank you all for having me today, ONDCP and HIDTA and all the participants. What a great event it's been. My name is Hagle. I'm co-director of the PTTC Network Coordinating Office in Kansas City, Missouri. I'm here today to talk about specifically the PTTC network, but I do want to start out by telling you about SAMHSA's training and technical assistance funded resources. There's a variety of training and technical assistance centers. I'm talking about the Technology Transfer Centers and the Prevention Technology Transfer Center in particular. But there are other resources like the Opioid Response Network, PCSS, and you have a link in your guide to connect to all of the SAMHSA-funded technical assistance centers and resources. So the Technology Transfer Center program, which is 3 networks, purpose is to develop and strengthen the specialized behavioral health and primary care healthcare workforce with the vision of helping to address substance use disorders and mental disorders across prevention, treatment, and recovery. And so you'll see that we're all structured similarly. So we have 3 networks, they're sister networks. I work at the network coordinating office, but we have an addiction, mental health, and prevention one. I'll get to the prevention one specific. But I wanted to make you aware there are resources that you would find relevant across both the mental health, HTTC, and the PTTC networks. We're all structured the same. We're all funded by SAMHSA. So each center has a network coordinating office, 2 population centers, and then 10 regional centers that really importantly align with the HHS regions. And I'll just go back a second. And again, you have links to all these resources and the websites in your resource packet and in the slides. So just to tell you a little bit about the large components of the TTC centers, we all operate similarly, but in our subject matters. So the network coordinating office, of which I work at the PTTC and the ATTC offices, coordinate activities, we liaison with national and international focused areas, and we provide the platform for the website and the learning management system. Our national population-specific centers focus specifically on subject matter expertise for those specific populations. They work nationally, but also with our regional centers. And our regional centers, again, are conformed to the Health and Human Services 10 regions, and I'll show those regions to you shortly in a map. And they work regionally as well as cross-regionally and nationally. But the beauty of the network is that we can scale up very quickly nationally. So who do the PTTC serve? Well, really, everyone on this session today has access to our resources. We, service all practitioners, organizations, and systems. We do customize our needs through annual reports with SAMHSA and our regional stakeholders or our population-specific stakeholder groups. So we serve everyone regardless of whether you have a SAMHSA-funded project. So that's very important to understand that you have these resources available to you. You don't have to be funded to access them. So what types of resources do we put forward? We develop, and we used to do in-person trainings. I'm sure we'll get back to that someday. But we do a host of virtual trainings, meetings, learning communities, project echoes. I'm going to give you some examples of the specific projects just to make make them meaningful in your minds. We have online courses, asynchronous, and a lot of webinar series that are topical. All of our resources are free and publicly available. If you're taking an online course, for example, the resource is free to take it, and we oftentimes offer continuing education credits, which if you want the specific credit for your discipline, there may be a very minimal fee for that, but otherwise all of our resources are free and available to the public. So this is a specific structure of the PTTC network. Again, all 3 of the technology transfer networks have the same structure. So these are our parent organizations that are funded to be and house the PTTC. And one of the key things is that we are structured regionally. So each state in the HHS regions has a PTTC and US territory. And that gives us the ability to scale up really quickly and to hone in on regional and local resources. One of the requirements of our grant with SAMHSA is that we have on our advisory boards state representatives for example, for the prevention group, we have the prevention, national prevention network coordinators from each state on our advisory boards so that we can assess and know local needs and fit those into our annual work plans. And this has really served an advantage. I just want to say that the ATTC network funded by SAMHSA is 28 years old. We've had 28 years of continuous funding. The PTTC and the mental health networks were just recently funded, and we're starting our 2nd year. So the regional centers also have focus areas of expertise, for example. Throughout today, I've heard of all the evidence-based practices that you guys have been discussing, so I'll just use this one example. So the University of Washington, HHS Region 10, has expertise around communities that care, for instance, a lot of practices. So our regional centers do have specific expertise areas, but they can also work across the country on specific local needs. So we have this ability to work regionally, cross-regionally, and scale up. So here's an example of cross-national projects. The PTTC network has focus area work groups in these 7 domains: community coalitions and collaborators, marijuana risk, evidence-based interventions, workforce development, data-informed decisions, and culturally and linguistically appropriate practices. These areas were identified as areas of needs through needs assessments that each of the regional centers conducted, and then we did a national analysis of those needs assessments. And for the last 2 years, these groups have been working on products for these high interest areas. So here's some examples of the specific products I think you'll find interesting. This morning, I heard that you guys had an excellent, HIDTA had sponsored the substance abuse skills training to the prevention specialists in the HIDTA network. And we have a learning community for the trainers that run the substance abuse prevention skills training. It's a very robust learning community to support those national trainers. We have learning labs that are applicable to how you apply prevention science to practice. And that's really a good segue from this afternoon's first panel about evidence-based practices. One of the publications that you have access to in your research file is the 6 Elements of Effective Coalitions. And again, this is based on the literature. We have a really great podcast series called The Data Dive, and it teaches you about using data, how to make data meaningful, which I do remember them mentioning in the last panel as well as an important component of delivering evidence-based interventions. We have an online course that highlights the importance of accessibility and prevention. We have a repository of resources on health equity and inclusion. We just finished a really exciting series that started as a result of COVID-19. We launched it in May and it went through September. And we hosted with the prevention and addiction communities strategic listening and learning sessions to address how we could address the social determinants of health for those who are differentially impacted by COVID-19, which is usually minority communities. And then we distilled the results of those sessions into themes and strategies, which we published on our website. This toolkit is one of our most popular because of a very important topic of marijuana. And so our work group created a marijuana prevention educational toolkit, which you have access to. And we have a great webinar series. We have many webinars, but one of the most important ones is on this important topic of vaping. So I just wanted to give you an example of some of our national projects. Now, as a regional center, they do respond to local needs. So here's I just took a couple examples from across the country. So in the New England Region 1 PTTC, they just conducted a Project ECHO series, which Project ECHO is a structured learning. It's a learning structured experience on the topic of vaping, and it was really well received by the prevention providers in Region 1. Region 2, the Northeastern Caribbean, has a training series that focuses on GIS information mapping, so geographical information systems. Central East PTTC, the Region 3, has a webinar series on evidence-based interventions and what approaches to use to implement them. And the Northeast region had a great distance learning series on 6 principles of the Prevention Code of Ethics. So we just wanted to give you a variety of examples of the types of regional products that we produce that you have access to, again, on our websites. So here's some examples from our national population centers. I mentioned we have 2 of them, but across all 3, prevention, addiction, and mental health. The National American Indian and Alaska Native, PTTC, has a really robust National Leadership Academy that they run to develop leadership within the tribal communities and specifically for the prevention field. And the National Hispanic and Latino PTTC had a learning community that focused on the reality of legal marijuana and Hispanic and Latino community youth communities. So again, I just wanted to share some of the examples of how relevant the PTTCs can be to you. All of these resources can be found on our website, which you have access to. Any of them that are live and sequential, you can register for. And many of them, we post the recordings if you can't make the live events, or they're asynchronous events. So visit our website. Just before I end here and hand it over to General Price in a moment, I just want to focus on our digital newsletter, the PTTC Post, and I welcome you to subscribe. We feature prevention articles and around prevention interventions or groups or organizations. We did a feature of the National Guard, and we would love to feature your program, and you'll have access to my email in about a second here. But please join our website or subscribe to our PTTC Post, follow us on Facebook and Twitter. And I really encourage you to reach out and let me know if you'd like to be interviewed or write an article for the PTTC Post. This is how you can contact me or anyone at my office. And I really appreciate your time today, and I'll hand it over to General Price.
Thank you, Holly. Slide up, please. Hi, I'm General Barrye Price from the Community Anti-Drug Coalitions of America. Next slide, please. And CADCA's vision is to create a world safe of healthy and drug-free communities. With this mission to strengthen the capacity of community coalitions and to create and maintain healthy, drug-free communities globally. Next slide, please. So in 2009 and 10, I was in Iraq, and we gave the war to the Iraqis, and the Americans played a support role. And while there, we had an organizational day on the 4th of July where we presented to the Iraqis uniquely American things. And one of the things that we did was brought them to a boxing smoker. And next to me was the imam the religious leader from Baghdad, and next to him was a Catholic priest. And there was a boxing smoker, and the two fighters came to the center of the ring to take their directions from the ring announcer, and he sent both back to their neutral corners. And one of the boxers, a soldier, did the crucifix. And the imam leaned over to the priest and said, "What does that mean?" And the priest said, "It doesn't mean a damn thing if you can't fight." And so if you ask the question, what does CADCA do? Truly, we not only build evidence-based multi-sectored coalitions, but we teach them how to fight. Next slide, please. So CADCA teaches our coalitions how to fight as advocates for policies, regulation, and laws on prevention. We arm them with primary prevention education that's second to none. We equip them with proven strategies for population level change, and we empower them through our regional, national, and international gravitas that's based on our alliances with leaders within the prevention space through engagement with executive and legislative branches of our government, and through our federal and corporate partnerships. Next slide, please. So little known to most is the fact that CADCA has a secret weapon, one that's both potent and known, one whose reach is well beyond conventional grasp, and one who opens doors, has the ear of Congress, and whose personal reputation precedes her. Our secret weapon is Miss Sue Thaw on this advocacy front. And if you don't know Sue, she's a must-have in your personal Rolodex. Next chart, please. For almost 29 years, CADCA has employed a public policy consultant who leads our efforts and has restored cuts and increased substance use prevention funding for over $3.1 billion over that time. But what is more, we teach our coalitions how to advocate locally within their states, and they join us in the DMV for forum annually, where we hold statewide meetings before they hear from panels of legislators on our Capitol Hill Day. That day concludes. The following day, we have a rally on Capitol Hill, followed by individuals meeting their legislators and their staffers. That's advocacy, and that is the expertise of Sue Thaw, truly an amazing talent and a force of nature for CADCA. Next chart, please. Next, we educate scores of volunteers on the latest and greatest in evidence-based, evidence-informed prevention science for multi-sector coalitions. Next chart. We teach coalitions how to work together. We help them to understand the power of their diversity and that maintaining their individual identity is the true source of their collective power. Finally, we help them to understand that we provide them with the tools to solve their own problems and challenges locally. Next chart. We also train our coalitions on this framework for community change, which is tried and true, and it truly does result in population level change. Next chart, please. And we educate them on the strategic prevention framework and help our coalitions in developing comprehensive planning documents that are both sustainable and culturally competent, which will inform their work. Next chart, please. We also train our coalitions on the 7 community strategies for change. Next chart, please. We also provide annual master's level of education training through our National Coalition Institute, which trains a rigorous training curriculum during the National Coalition Academy. And for those who are mature as coalitions, the Graduate Coalition Academy, which is tailored for those who are more seasoned and advanced in their coalition work. Next chart, please. And we provide our coalitions with the opportunity to refresh their training on the latest innovations in the field of prevention during our signature training events. That's the forum that's held the first week of February every year, and then our mid-year training institute, which is held in the summers, and that rotates around the country. Forum is always in Washington, D.C. And then we have specialized state-level trainings, which are tailored trainings, and much of the work that we do with DEA 360 constitutes that training. Next chart, please. Last year, we trained over 12,000 individuals and are reaching even more during this COVID virtual environment through virtual opportunities. Next slide, please. Finally, you should know that it works. If you can show me a $125,000 program that achieved these types of results, this is the best. This is a phenomenal program, and return on investment in these communities are phenomenal. Next chart, please. Next, we equip our coalitions with sophisticated tools and strategies and resources. Next chart, please. Like our primer series, which places meat on the bones of how our coalitions should operate, or our practical theorists, which provides the latest research topics which impact the prevention field. During the last 2 years, we've created 3 practical theorists. One focused on the opioid crisis, the second, which focused on electronic nicotine delivery systems, and our latest one, which focuses on the current state of affairs with cannabis. Next slide, please. COVID has moved the needle on how we reach people. We had our first ever National Coalition Academy trainings virtually, beginning in May. We had our first ever mid-year virtual training which would have taken place in Nashville, Tennessee. We held it online, and we reached more than 3,000 people. And so this virtual environment has really worked for us, and it's given us a new medium for reaching our coalition members. Next slide, please. Finally, we empower our coalitions through our reach, through the resources that you provide, and through our partnerships. Next slide, please. And just a listing of some of our federal partners. And next slide. And some of our major industry partners. And next slide. And we're on all medium of social messaging. And so I look forward to your questions after the presentation. Thank you.
Good afternoon, everyone, and welcome. I want to thank our host for having me here today, and along with the panelists I get to share this virtual stage with. It's an honor to be with everyone. So my name is Helen Hernandez, and I'm here to talk to you about the Drug-Free Community Support Program. The Drug-Free Community Support Program is a federal grant program that funds community coalitions across the country to focus on youth, substance use prevention. And the grant is, it's a collaboration, just like we encourage our community coalitions across the country to seek out other partners and sectors and different parts of their communities for expertise to help them accomplish their goals. ONDCP does the same. And so we at ONDCP, although you heard from our director, we are mostly a policy shop. The DFC program is very uniquely positioned, as is the HIDTA program at ONDCP. Both programs serve as a pulse check for our director, who you heard from this morning, and an opportunity to receive a pulse check on what's going on across the country. So we seek out other partners as well. The DFC program is currently managed, and the day-to-day management of that program happens with the Centers for Disease Control and Prevention, specifically the National Center for Injury Prevention and Control. This is a new partnership that we're thrilled to be engaging with. But a little bit more about the DFC program. We fund community coalitions across the country up to $125,000 per year for 5 years, at which point community coalitions can recompete for an additional 5-year cycle. So a community coalition can potentially be receiving DFC dollars for a maximum of 10 years. And that's unheard of in the grants world. And something else that's unique about the DFC program is that the funds go directly to the community coalition. So we don't go through the state, we go directly to that coalition who's trying to do good work in their communities. So again, DFC is unique. And as I mentioned, we're also seeking and engaging with other partners across the federal government. But we also do that with non-governmental entities. So we at ONDCP partner with CADCA, Community Anti-Drugs Coalitions of America, and General Price and his team to provide training and technical assistance to community coalitions across the country so that they can be successful, they can be more effective, much faster, and see reductions in youth substance use. So it's all about partnerships within the DFC program. The DFC program by statute has two very specific goals. The first is to establish and strengthen community collaboration, and the second is to reduce substance use. And I'm happy to report, and I'll show you that or share a little bit about our success in being able to meet those two goals. But the theory of the DFC program is that local problems require local solutions. I, at ONDCP in Washington, D.C., cannot tell you how to address the substance abuse problems in your community. You're the experts. You are the movers and shakers in your community, and you know your community best. So what ONDCP does is provide you the funding and the networks. We connect with CDC, we connect you with CADCA, so that you can be effective, so that you have the trainings and the skills and the resources you need so that you could do your work. And we focus on environmental change. We focus on changing the environment in which drug use happens, because by focusing on environmental change, ultimately that contributes to reductions in substance use, and over time, of course, among adults. For those of you who may not be sure what a community coalition is, or if your group group, your entity, or your organization would constitute a community coalition. The DFC coalition definition is a community-based formal arrangement of cooperation and collaboration among groups or sectors of a community in which each group retains its identity, but all agree to work together towards a common goal. But of course, they all work together to build a safe, healthy, and drug-free community. And that's what's important about the DFC program. We fund community coalitions. We require that our community coalitions, in order to apply to the DFC program, be at least 6 months old at the time of application. So if you're unsure of whether you're eligible or would be able to apply, you have to have been meeting and organized for at least 6 months. You must also have representatives from 12 unique sectors: parents, youth, business, media, schools, youth-serving organizations. Law enforcement is an excellent partner for the DFC program. We're seeing a lot of effectiveness when there's that strong relationship with law enforcement. Religious and fraternal organizations, civic and volunteer groups, healthcare professionals, state, local, tribal governments, and other organizations. That other by statute is really nice because it's a catch-all. So what we've been seeing a lot lately as far as sector representatives representing this other group, we've seen a lot of treatment facilities and a lot of recovery homes participating in prevention, which is really nice to see, the breaking down of those silos. So I mentioned we work closely with CADCA, and so our community coalitions, once they enter the DFC program and join what we call our family, they get trained on the 7 strategies for community change. And again, there's 7 strategies that focus on not only the individual, but also on the environmental, making sure that we're changing the environment in which a young person lives. The example I always like to give is we want to change the environment in which a young person comes off a school bus and has to walk home. What they see, what their surroundings are, is very important. We want to make that a healthy and safe environment. The DFC program, I'm very happy to say, is very effective, and it's thanks to those community coalitions who work hard every single day to make this happen. Of course, our partners play an important role in the training and the resources and the support to our coalitions. But the DFC program, we collect data on 4 core measures: alcohol, tobacco, marijuana, and prescription drugs. And we collect that for 4 measures: past 30-day use, perception of risk or harm, perception of parental disapproval, and perception of peer disapproval. And we're seeing significant decreases across the board amongst middle school and high school age kids. And so that is all thanks to the work of our coalitions across the country. Once you're a part of the DFC program, we provide you with and you're submitting data. Most grants, most federal grant programs, once you become a part of that program, they will request data from you. And it's oftentimes one way. Something that we've really focused in within the DFC program is that, yes, you provide us data, but then we're able to pass that back on to our coalition so that they can tell their story. We want you to see your successes, and we provide those to you in charts and graphs that you can use as a part of the work that you do every day. So we're seeing, again, significant decreases in alcohol, tobacco, marijuana, and prescription drugs. And our latest end-of-year report is on the ONDCP website. So I would encourage you to go to whitehouse.gov/ONDCP for more information about the success of the DFC program. I mentioned it's a federal grant program, so I want to very quickly go over that funding cycle for anyone that might be interested in considering and applying in the next few months, really. So we plan to release a notice of funding opportunity announcement through grants.gov with our partners at CDC sometime early in the new year. And then our applicants are going to be given at least 60 days to apply to the DFC program, and we'll make announcements in September. So before the end, or as soon as January hits, we will start planning some training sessions. So I'd encourage you to keep an eye on the ONDCP DFC webpage, because as soon as we have some training opportunities on how to apply to the DFC program, that's where we'll be posting that. But you can also email me at any time. You can email me at dfc@ondcp.eop.gov. I want to thank you for your time and thank you for the work that you all do every day to keep our community safe. I'm next going to pass it on to my good friend Sean Fearns at DEA.
Helen, thank you very much, and I appreciate that. And big kudos to all of our friends at HIDTA and ONDCP, and also big kudos to ADAPT for putting on this virtual training. I sure do wish that we could be together in person, but this is obviously the next best thing. My name is Sean Fearns. I'm the head of our DEA Community Outreach and Prevention Support efforts, based out of DEA headquarters in Washington, D.C. I want to make sure that everybody understands that we've got some resources that are available to you. If we could bring up the first slide, please. The very first one. That was our, yeah, perfect. The phone number and email address. So if there's any follow-up at all that you would like to have with us at the national level, please feel free to use our email and our phone number. Now we'll go ahead and go to the next slide. And this is probably the biggest resource that we would have available, and that's human resources. DEA has 23 field divisions around the United States. Each one of these DEA field divisions has a demand reduction coordinator. Most are getting community outreach specialists. And with gratitude to HIDTA, we have extended invitations today to all of our demand reduction coordinators and community outreach specialists, many of whom are participating in today's Prevention Summit. These folks are available to you to provide information, materials, drug intelligence information that you can in turn share with your community. I'll make reference to our handouts because there are a number of them that DEA is providing to you today as attachments to this session. The very first handout is a list by state of the DEA demand reduction coordinators and their email address and phone number so that you can reach out to them. Helen made a really important point about, prevention has to be local. Good prevention is always local. And so our local boots on the ground are available to help you. And I want to encourage you to do that. We are looking to provide additional community outreach specialists in our DEA field divisions in the months and years ahead. DEA has been in this field, in this space, since 1985. And if you're not familiar with the tragic story of DEA Special Agent Enrique Kiki Camarena, he is one of the major drivers for the Red Ribbon campaign that started following his kidnapping, torture, and murder. And even today, Red Ribbon continues. And we'll talk about Red Ribbon in a minute. But the DEA is in this space to wave the flag in support of prevention and to provide tools and resources to help along the way. Go ahead and move on to the next slide. And let me focus on some COVID-friendly materials because we have pivoted, just like everyone else, to digital engagement. We have 4 main websites that we maintain on a daily basis for 4 different target audiences. We'll start in the top left. The first one is justthinktwice.com. This is a website aimed for a teen audience. And my message to you today is to steal, use, and abuse the content from these websites. The more folks that get access to this information, the more awareness that we raise, then we can move toward attitude change and then behavior change. So justthinktwice.com for teens. The next one, top right corner of the slide, getsmartaboutdrugs.com. This is geared toward a parent or caregiver audience. There's a lot of great information. We always are looking to make it timely and topical for major drug trends that DEA is seeing through our National Drug Threat Assessment, and of course in line with the National Drug Control Policy and the major points that ONDCP always wants to make sure that everyone hears about. Bottom left corner of the slide is campusdrugprevention.gov. Notice the .gov. So this is our newest website, and a couple of years ago it was our foray into supporting the work of prevention practitioners on college and university campuses, many of whom want desperately to do the very best for college and university students, but had lots of different places to go. So think of this as a one-stop shop. It is content from DEA, from HIDTA, from SAMHSA, from Department of Education, from many federal and state and local partners as well. So if you're looking to engage with colleges and universities on prevention, great resource. Brand new publication on best practices for using the strategic prevention framework for addressing college and university audiences. And then the last website here, bottom right corner of the slide, is Operation Prevention. We are in the 4th year of a multi-year program in partnership with the Discovery Channel, specifically the part of Discovery called Discovery Education. And they develop fun, interactive, high-tech digital platform lessons and other materials for schools to use in the classroom on a variety of topics. Operation Prevention started specifically on opioids. It was part of our DEA 360 strategy response to the opioid epidemic, and providing material at an elementary, middle, and high school level that is science-based and evidence-informed, that is interactive and engaging, and that allows teachers to adapt this material and use it in the classroom, for homeschool parents to use it at home, and for other locations. Now, in the last year, we added another line of materials, and that's for the workplace. So there's actually a whole series of workplace materials that employers can use to engage their employees on the importance of preventing opioid misuse in the first place, and then the importance of seeking treatment and supporting recovery and supporting employees as they continue. We just yesterday launched another enhancement to this program. We obviously don't want to just chase the drug du jour. We want to have materials available regardless of the drug threat. And there are different drug threats in different parts of the country. So as of yesterday, Operation Prevention is now available to address all other different types of drugs of abuse, from marijuana to stimulants to inhalants and the like. So please feel free. Back to this issue of attachments and handouts. We have 3 handouts that are related to Operation Prevention. There's an overview of the program as one attachment. There is a guide to the workplace piece. That is the second Operation Prevention attachment handout. And then the third one is our parent toolkit, materials that are available for parents to use in conjunction with Operation Prevention. We also do all of that at-home materials translated into Spanish. Let's go ahead and move on to the next slide if we could. So in the old days, back, again, this program for us started in the 80s. It was all about print publications. And we still conduct and develop print materials, but they're available in a digital format. A couple of them that I want to highlight for you, simply mention at the top that GetSmartAboutDrugs.com is where all the digital copies of these publications are available to you. Right in the top right corner of the website is download the publications. On the slide there, you see a couple of covers. One is Growing Up Drug Free. We've been doing this publication for a number of years. It was updated 2 years ago. It is our joint publication with the U.S. Department of Education. And it's a great parent toolkit material. The next one is Drugs of Abuse. We look at this as our Bible. It's the longest running publication that we've done, and it is a wonderful desk reference with lots of deep dive information about all different drugs that are controlled under the Controlled Substances Act. There's lots of other publications. I won't get into all of them because we're going to run out of time, but we also have Spanish translations of those. If we could go to the last slide. And I want to highlight 2 upcoming efforts, and Director Carroll, I can't tell you how delighted we are that you're mentioning Red Ribbon and wearing the Red Ribbon pin today. Red Ribbon Week is coming up the last week of October. If you go to dea.gov/Red Ribbon, we actually launched on October 1st, which is the beginning of National Drug Abuse Prevention Month, with materials and a virtual Red Ribbon rally that individuals can share at the local level. Red Ribbon is not a prevention program. It is a campaign to raise awareness of the importance of preventing substance misuse and abuse. You can use it to engage your populations and your communities regardless of the drug of abuse. And the week itself is always the last week of October. The second and final one that I want to mention is, please, if you haven't already marked your calendars and help to spread the word, the next National Prescription Drug Take Back Day has been confirmed. It will be happening on October 24th. That's a Saturday. It always happens from 10 a.m. to 2 p.m. local time in whatever time zone we're in. Regrettably, we had to postpone and then eventually cancel the Take Back event that always happens in the spring in April. But we are doing Take Back for October 24th. The website for that is on the slide for you, deatakeback.com. There is a live locator for finding take-back locations that are going to be available on October 24th. And of course, we and all of our partners are doing everything we can to promote the importance of discarding unused, expired, or unwanted medications, not just on Take-Back Day, but every day of the year. And we're grateful for having worked with the National Governors Association and Google and others to drive awareness of year-round take-back locations that are available. So with that, again, just please feel free to use and abuse the DEA resources and the materials. I know many of you at local HIDTAs are already in touch with local DEA offices. Please continue to do that. We encourage it and we value it. We are working alongside you on the enforcement side. We welcome you on this new front, and we're delighted and excited. And again, thank you very much to HIDTA for including us today in this panel. I will shut up and open it up to see if anybody has questions for our panel. Thank you very much.
Macro and micro levels. Okay. So thank you again to our panelists. We actually do have a few questions, and I'm going to really address maybe some of the ones that might warrant a shorter response due to the time right now. But a question for Helen Hernandez: does a DFC coalition have to be a 501c3? Okay.
There we go.
There we go. Okay. Helen, the question was, does a DFC coalition have to be a 501c3?
Thank you for the question. So for community coalitions interested in applying to the DFC program, you can either be a 501c3 and apply for the grant on your own, or you can, if you're not a 501c3, we still encourage your application. The only difference is you would be applying with some other, you'd have to partner with another organization to serve as your fiduciary. So you would enter into a memorandum of understanding that would be a part of your application, and you'd have to document that relationship between the coalition and the fiduciary. That fiduciary is applying for the DFC grant on your behalf.
Wonderful. Thank you, Helen. The next question goes to Jessica Wolff at the CDC. Is there a decision about the 2020 Cornerstone Project topic?
Hey, thanks for that question. I think it was so please stay tuned. An email will be coming out to all of the overdose response strategy next week with an update about our next Cornerstone. The topic will be in the timeline as
Jessica, we're having a hard time hearing you.
Sorry, can you hear me any better now?
Yes, thank you.
Okay, so I was just saying hi to Sydney Fox, who asked that question. Great to see you on here. And just letting her know to stay tuned. An email will be going out to all of the overdose response strategy next week with an update about the next Cornerstone project, including the topic and the timeline.
Wonderful. Thank you. We had a question, an interesting question come in about how many people have participated in today's Prevention Summit. And I can tell you we had over 2,000 registrants for today's summit, and we haven't received any word on exactly how many have logged in, other than knowing at least over 1,000 have been participating at different points in time throughout the day. So we were glad so many were able to join us. Okay, we're receiving a lot of thank yous for our panelists, saying it was a wonderful day. And I believe there was one more. The DEA Take Back event for you, Sean. The DEA Take Back event. Does that include all states, including Arizona?
Yes, great question. So we have put out the call to state and local law enforcement, sheriffs across the country, all 50 states, and have asked them to sign up for Take Back locations. I saw the question and did a check on the DEATakeback.com website, and we don't currently have Arizona locations available yet, but I think that that will probably end up every day we get more and more Take Back locations signing up to be part of the program. So I would be shocked if there are not locations in Arizona by the time we get to October 24th, but it is a nationwide effort, yes.
Excellent. Thank you for that. All right, we have had a couple other questions, and throughout the day, we've had many questions around how you can access the resources that have been mentioned today. And I will respond with check your event resources tab. And I've been made aware that the slides for today are available under that tab, but only the slides for today. So I wanted to share something exciting with you. Tomorrow morning, you actually all will receive a link. Believe it or not, it's the same link that you used to log in today, but you will receive a link to access all of today's presentations in an on-demand type fashion. And underneath each section, then you're able to download the resources for that particular event. So you will have access to all of them and much more, not just the resources, but the actual presentations themselves. We want to thank GoToWebcast platform for that, because they have made that very easy on you as audience members. So I wanted to thank the panel one more time. We really appreciate you joining us today, and move into a final thank you for all of your patience and for giving us grace today as we have tried to bring to you a virtual program, a day-long virtual program free of charge, and have navigated various technical challenges to make that happen. But all in all, we made it, and we are very pleased that you were able to join us today. One last thing I wanted to mention, we've had questions come in on and off around a certificate, and we will be providing a certificate of participation. It will be emailed to all of those who have logged in for a substantial amount of time today. I believe they're still working on determining exactly how much time you need it to be formally logged in, but that certificate of participation will be available sometime to you within the next 2 weeks, and it will be emailed directly to the email you used to log in and register for the event. At this time, on behalf of the ADAPT team and the ADAPT Advisory Council, I'd like to sincerely thank you for joining us today for the HIDTA Prevention Summit. And I'll turn it over to Jamie Delano for our concluding remarks. Thank you so much.
What an incredible day. So this day could not have happened without Dr. Amber Scheer, Dr. Laura Papard, Fred Dubon, and Natalie Shaw. Thank you so much for everything to make this day a tremendous, tremendous success. We started the day out hearing from Shannon Kelly, Director of the National HIDTA Office, emphasizing the importance of public health and public safety partnerships. You received an overview of the HIDTA prevention strategy, and Dr. Papard provided an outline of ADAPT, the division the HIDTA uses to operationalize and support HIDTA communities with implementing HIDTA prevention strategy. We were honored to have Director Carroll, Surgeon General Adams, Deputy Director Kleinschmidt with us to discuss the whole of government approach to address substance use disorders, the importance of public health and public safety efforts currently funded by the federal government, and stressing the importance and the appreciation of all your work keeping our communities safe with the negative sequelae of addiction. And then we were treated to an amazing presentation by Dr. Nora Volkow, the director of the National Institutes of Health, National Institute on Drug Abuse, on the imaging studies of the brain of people addicted to drugs, helping to clarify the mechanisms of drug addiction. We heard from the team at CDC, Doctors Grant Baldwin, Rita Noonan, Karen Vosch, who discussed drug-free communities, the role of adverse childhood experiences as risk factors for developing a substance use disorder, and the surveillance system of the OD map. The National Prevention Science Coalition to Improve Lives was next up. We heard from Dr. Diana Fishman, Dr. William Aldridge, and Dr. Robin Jenkins. They really helped us to understand further the neuroscience around the reasons individuals have difficulty self-regulating and how intervening early interventions yield really good outcomes for developmental trajectory. Research also that they provided to us indicates that it is never too early, never too late to intervene. And in fact, there are tremendous opportunities to intervene during adolescent years. Also discussed is the importance of keeping to the fidelity of the core ingredients when implementing programs to achieve participant success and the economics of prevention. And finally, we concluded with great presentations on prevention resources from CDC, Jessica Wolff, Holly Hagle from the SAMHSA Prevention Technology Transfer Center, General Price from CADCA, Helen Hernandez from ONDCP DFC, and Sean Fearns of the DEA 360 program. So I just want to let you know that in 2 weeks, we will be sending out an evaluation. And I know how everybody loves to fill out evaluations for this event. And we would love to have you respond to this, because it will inform our way forward and offering future summits and also meetings. Thank you for joining us today on this journey towards extraordinary. Have a wonderful rest of your day and evening. Thank you.